Next, we will look at how the severity of liver disease is measured. The Child-Pugh score is used to measure cirrhosis. It determines the prognosis and level of treatment required. It uses 5 clinical measures, including total bilirubin, serum albumin, prothrombin time, ascites, and hepatic encephalopathy. Each measure is scored from 1 to 3 points and added together to give the Child-Pugh score. A higher score indicates a more severe derangement of liver function. The Child-Pugh score is classed as A, B, and C depending on the number of points and severity of the liver disease. Other measures used include the UCALD, which is the United Kingdom End-Stage Liver Disease, and the MELD, which is the Model of End-Stage Liver Disease. These are scoring systems used to predict mortality among patients waiting for a liver transplant. They take into account INR, serum creatinine, serum bilirubin, and serum sodium. We will now talk about some other conditions which are associated with liver disease.
Spontaneous bacterial peritonitis, or SBP, is an infection of the acidic fluid. It is treated with IV antibiotics. There is evidence for prophylactic antibiotics after one episode of SBP. Cholangitis is inflammation of the biliary tree caused by obstruction, infection, or invasive tumors. Symptoms include jaundice, nausea, vomiting, pain, fever, and chills.
Hepatorenal syndrome is an impaired kidney function which occurs in patients with severe liver disease, especially cirrhosis. The cause is unknown but is thought to be related to the narrowing of blood vessels that feed the kidneys, resulting in decreased blood flow and eventually impaired kidney function. It occurs in up to 20% of cirrhotic patients. The only curative treatment is liver transplant. Nutrition considerations for when seeing patients with hepatorenal syndrome include considering their renal function when looking at protein requirements and also checking their potassium and phosphate levels. Pancreatitis can be classified as acute, which is inflammation of the pancreas, or chronic, which is chronic inflammation of the pancreas leading to irreversible damage and pancreatic insufficiency. Nutrition considerations when seeing these patients include checking their bowels, asking about signs of malabsorption, getting their fecal elastase checked, and considering the need for PERT if they're having signs of malabsorption. Osteoporosis has a high prevalence in cholestatic diseases. The prevalence is 20 to 45% in PBC and 15% in PSC. Risk factors for osteoporosis include poor intake and absorption of calcium, altered vitamin D synthesis, malnutrition, steroids, low BMI, alcohol excess, and physical inactivity. Nutrition considerations include the calcium, vitamin D, and protein intake. Wernicke's and Korsakoff syndrome are caused by excessive alcohol intake over a prolonged period of time, causing damage to the brain. It can be caused by thiamine deficiency, the effect of alcohol on the nerve cells, and head injury or blood vessel damage. Wernicke's encephalopathy is a sudden onset, movement and balance problems, loss of coordination, confusion, disorientation, abnormal eye movements. Korsakoff syndrome has a more gradual onset, including problems with attention and concentration, gaps in memory, confabulation, and difficulty learning new information. Some people with these conditions can recover with abstinence from alcohol